on Friday, you will receive the links to the audios. We will now going to retype the minutes. The first three items on the agenda will actually be covered by Robin. So Robin, please go ahead.
Okay, so A and B, I'm going to combine the summary because they're very similar. But every year in November, the board begins to work on having peer reviews conducted for Firelands Counseling and Recovery Services and Oriana House. This year, the board worked with Jessica Braz. She's a licensed professional clinical counselor from Kulinia Counseling and Consulting of Toledo. We got her information from the Lucas County Board. They've done a lot of work with her, and we asked her to review our fiscal year 19 services for the two agencies. This was a new reviewer. The board prefers to change reviewers every few years just to get a new perspective. In previous years, we've worked with Mike Witzke and Jody D. Mohajans. They're both prior board directors in other districts who have conducted the reviews. This year, the review for Firelands occurred on February 17th and 18th, and it included 20 mental health files and 20 substance use disorder files. The review for Oriana House occurred on February 27th, 2020, and that consisted of 20 substance use disorder cases, just like they have in previous years. I go through and I select the cases just based on high-risk services and high utilizations, and that's my guide, but otherwise it's pretty random selection of cases. This reviewer found both agencies' charts to be, and I quote, thorough, complete, and provided a summary of the high quality of services. She went on to indicate that the documentation displayed collaboration with other stakeholders. These continue to be what's seen year to year with both agencies. There were no major deficiencies. There were some recommendations with regards to missing items and documentation. I spoke with, and she indicated with the clinical leadership team for both agencies, they were receptive to the feedback and agreed to address the feedback through staff trainings. If anybody wants a copy of the reviews, I have them available, but I'll need the board to approve that I send these on to each agency, OMAS, and their agency's board of directors.
This is a standard procedure for Firelands and Oriana House that we conduct every year with a contractor from the outside, as Robin mentioned. So if you have any questions, please, now is the time to ask or any comments.
Just as a reminder, everybody's on mute. So if you do have a question, just hit the little mute button and you'll be able to talk.
Okay, no questions. Robin, before you move to number 2, I want to make sure the only person we are missing is Kelly. Is that correct? Okay. So
Did we need to do a roll call?
No, no motions during the committee meetings. I just wanted to make sure we have everybody else on, which I do see that we do have. Okay. Go to number 2, please.
All right, next one is Lotus Recovery House. Following our March board meeting, I initiated with the Ohio Recovery Housing for our certification application for the home. As part of that process, I received feedback on items to revise on one of our policies and then a few of our forms to ensure we meet all their standards. Their feedback was to indicate whether we accept rent payments from any other source than the resident, which we do. We have done that. And so they also wanted us to be clear if there were any other costs for the residents that was not already listed on our forms. We also need to be clear on whether the residents would ever be compensated for work performed for the board, Lotus Recovery House, or any associated entity. In this case, that could be like a Little Faith Ministries, which we do not intend to compensate them or reduce fees for any work performed. We also need to be clear on how urine, drug, and alcohol screens are being paid for, which we actually cover the cost for the urine screens at the house. If a resident chooses to go elsewhere, they can, but the ones that we conduct or have conducted, we will cover that cost. We also need a statement prohibiting staff from lending or borrowing any money from the residents. So as we were addressing how we would implement these changes, we were asked by the residents to have a fire pit at the house to allow them to be able to socialize, relax, and have a more home-like atmosphere. So during our phone interview for the certification with Ohio Recovery Housing, which also included somebody who runs several homes, I asked for guidance on this request. We confirmed that there's no standard against having one, and they recommended that we do support their request, but that we consider it a privilege and not a right, so it could be taken away from them at any point by staff, and that we also explore any local ordinances. So after consulting with Tiffin Fire and EMS Chief and our insurance agent, Andy Steffi, I am recommending that we allow this to occur as a privilege to the residents. It's not limited or excluded on our insurance, and we can meet the local ordinances to be able to have this. So I've addressed this through our emergency, safety, and property policy, our resident handbook and house rules, safety signature form, and quarterly safety and fire drills. Having had a fire there back in January, I just want to make sure we get everything covered. On Monday, this past Monday, the 18th, I held a Lotus Recovery House Advisory Committee meeting to review everything that I'm going to recommend tonight, and the committee recommended that the board approve all the revisions. So my recommendation tonight would be for the board to approve the revisions to the following: the resident handbook and house rules, Lotus Recovery House alcohol and drug testing policy, the Lotus Recovery House volunteer ethics and standards agreement and orientation form, to include a version that covers staff to the home, and then the Lotus Recovery House emergency, safety, and property policy and safety signature forms. All these two policies and the forms will cover what was recommended in the certification process as well as the fire pit.
I think that's a great thing for them to be able to socialize and do things like that. So I think that's a great idea and request.
Who's going to pay for this fire pit?
Currently, we have a state opiate response grant that we would include this in our expenses that are covered under the grant.
Do you want us to make a motion or anything?
No motion tonight. This will be for the meeting on next Thursday.
Will they need any like lawn chairs or anything like that to go? I mean, do they have chairs?
They have some. I do have someone from the advisory committee. Her husband was going to go over to the house with Stephanie just to get some ideas of how to set a fire pit up safely in the home. Making sure it's 25 feet away from any garage or the house, but also things like, do you put it on landscaping rocks? Well, apparently you don't. You have to put it on special rocks. And so this person was going to assist to make sure we do it right. But yes, they already have some chairs. I'm sure they'll want marshmallows and things to make s'mores.
Heck yeah.
So, Robin, back to the cost. I just want to clarify a few things. So, through the SOR grant, we as a board will approve operational costs to be built under that grant specific to Lotus Recovery House, where any additional cost to install a new fire pit or a lounge chair will be covered under that grant. Is that correct?
Correct, under supplies.
Okay. And then another thing to clarify, the motions next Thursday will not be specific to the fire pit. It will be just changes to the current policies and procedures regarding Lotus Recovery House.
And the forms that I indicated, yeah, because those were previously approved by the board.
And once the board approves this, you will then resubmit them to Ohio Recovery Housing for final approval. Is that correct?
Correct.
And then really the last step will be for Ohio Recovery Housing to do an on-site visit prior to giving us the certification. Is that correct?
Correct. We did the phone interview, we submitted all the documentation, and once COVID-19 is over, well, not over, but allows them to come to the home, they'll come to the home and do the site visit. And then I don't see any concerns at this point. After the site visit, we should be able to receive our certification.
And just some kudos to Robin here. I'm not sure in one of my recent memos, I'm not sure in which document, but I believe, quoted one of the emails we received from Ohio Recovery Housing regarding the work Robin and Stephanie have done for the policies and procedures that were submitted to Ohio Recovery Housing. And to quote the email, I believe she said something to the effect that these were probably the most complex policies she have reviewed for any recovery house in Ohio, which again, it tells you the outstanding job that Robin have done.
Thank you.
Any other comments regarding the recovery house?
I'm just curious, and so are almost 100,000 citizens.
Hey, Robin, how many residents we have there today?
Why it suddenly got voted down.
Today, we have 5, and somebody is moving in on Friday, so we'll be to 6.
Okay.
And then we have another one to move in next week. So by next week, we should be at full capacity again.
And I guess one more question, just to go back, if we go back to the next 3-4 months, would you say that 80% plus we were at full capacity?
Yes, we could have been at full capacity, but with COVID-19, once we hit like right around March 22nd, we did not have anybody move in, and we had 2 move out. So only since the beginning of May, we started revisiting the wait list and moving individuals back into the home to fill those beds.
Okay. Please go ahead with item number 3.
Okay, this agenda item is in regards to the Community Transition Program, or CTP funds, that we received through OMAS. For fiscal year 20, we were originally allocated a total of $30,000 from these funds. $20,000 was awarded from GRF 421, Criminal Justice Services 336 422, and $10,000 was awarded from GRF Additional Services with Department of Rehabilitation and Corrections 336423 funds. We contracted these funds to Firelands and Oriana House to help residents released from prison who were or are in need of behavioral health services and supports. We were recently alerted that we were awarded an additional $24,696 in these funds, which we had not requested and didn't realize that we were going to get. As of May 11th, we had received all of these awarded funds in the amount of $54,696. I do want to highlight some items with these funds. These funds can only be used on persons identified through OMAS and the prison system. So the 2 agencies cannot go out and try and recruit clients or get any additional clients. These are very specific clients who can use these funds. The agencies are very flexible and prompt in offering services when they are asked to serve them. The agencies are asked to help these individuals get on Medicaid, and so most of them are eligible for Medicaid. So the funding ends up not being used for treatment services, and they mostly get used for supportive services like transportation or rent services. So in review of the utilization of these funds to date, it's projected that the agencies don't need these additional funds in fiscal year 20. So we're recommending that these funds not be awarded to either of the two agencies in fiscal year 20, and that we request them as carryover funds from OMAS for fiscal year 21. And then once we know what our carryover amount is, we'll award the 21 funds to the two agencies.
What qualifies what identifies them as being eligible through OMAS? Is it just because they have the mental health diagnosis prior to being incarcerated?
It could be mental health or drug and alcohol, and they're in the prison system. As long as they've been labeled that or received some type of services, they'll get an assessment before they leave to figure out exactly what their needs might be, and then we link them with one of the two agencies.
So
Fire takes the mental health ones, or the dual diagnosis cases of mental health and AOD, and then Rigel takes just the AOD ones, unless a client prefers and requests to have AOD at Firelands, then they'll get referred to Firelands.
So the individual does not have to reach out, they reach out to them?
Yeah, they get an appointment on almost all the cases prior to their release date. They have an appointment with the agency. There's been a few cases that something happens in the criminal justice world where they're released, but we haven't been identified. So then once they have the information and they tell us, we go back and try and find the client with the probation officer and get them linked. But almost all of them have an appointment before they even leave the prison system.
Does it include like the rehabilitation homes that are like not really like the halfway houses, but if they're released to that, or is it still prior to that, even if it's a lockdown type of facility, step down from prison?
I haven't had anybody come out under that scenario. They do have special housing. It's very limited, and I don't know that it's halfway housing. That if somebody needs housing and they get on the list and a bed becomes available, they go into that setting. But we haven't had anybody come out that's been in halfway housing of any type. Now, maybe in Cleveland or Columbus area they do, but we haven't had anybody here. These usually are individuals that are moving in with family, a girlfriend, a boyfriend, another friend. They're going into independent housing settings.
Hey, Robin, how many unduplicated individuals you will say that we had in fiscal year 2020?
I don't know if I can give you an exact, but I do track it. And I would say at this point, probably maybe 20. Not everybody shows up. That's part of the struggle with using the funds that they've been allocated, is if somebody doesn't show up for treatment, then the agencies will do what they can to outreach and get them rescheduled and get them engaged. But if they don't show, and some of them have not, I think when I looked at that in January and reported on it, it was somewhere around 60% that were showing up for services.
So again, just to clarify, the CTP funds they will receive from the state are specific to this population, and the funds that we already approve in the contracts for this fiscal year are already, how do I say, more than what we really need so far.
Correct.
So the agencies leave money on the table. So when the state sent us this email 2 weeks ago, say, hey, by the way, here is more funds, as of today, we can't really make a recommendation and say, hey, give this agency more money, if they already have money on the table.
Correct.
We just want to give you a heads up. We got this. Robin and in our office will probably go ahead and request a carryover request from the state to allow us to use the money to the next fiscal year. But I know approving it into a contract is really not going to make any difference.
I just had one more question about that program, sorry, but is there a cap on how much one person can receive, like how much assistance they can receive and for a length of time?
There's no cap. As long as the funding is available, we're able to serve them, but there's no cap. They leave that up to a local decision. If we're going to help maybe with a cell phone or something, because the agencies began to use more of the telehealth services, and we ran into issues across the state where some individuals didn't have cell phones. So they alerted us that, cell phones can be purchased, but it's up to our local decision as far as, do we want to put a cap, or do we want to say it's only good for 3 months? Right now, our budget allows us to be flexible in what the client needs. Can't buy a car with these funds.
Why not? The money's there, right?
Yeah, when we asked for limitations, that was the real big one. Don't buy a car.
Now, Robin, clinical services. I should say, Oriana House and Fallens will have to assist these individuals enroll in Medicaid if they are Medicaid eligible to cover the clinical treatment services. Is that correct?
Correct.
So keep in mind, if Fallens or Oriana House enrolls them in Medicaid and Medicaid is paying for clinical services, that is another reason why we can't really draw down these funds. We won't be able to pay for an individual, supplant the payment for one individual. So no motion under this number 3. Any other questions? Okay, number 4. I received an email from GLCAP, which is the previous WSOS. I want you guys to know that in fiscal year 2020, we awarded them $4,250 for a program called Fostoria Youth Build. This was a program for individuals ages 18 to 24 who are low income, or maybe who are in foster care, or maybe who were school dropout. And they partner with Fostoria Learning Center, Seneca County DJFS, the courts, Ohio Miss Job, Sandal and Vanguard, and Terra State Community College for a 6-month program to help these individuals learn new skills and link to trade jobs. Portion of this program was to provide or to conduct drug screens for these 18 to 24 individuals, and also assist them with client transportation and link them with treatment services if needed. So they wanted to make sure that because of mental health or maybe because of an addiction issue, there is not a barrier for them to complete this program. A year ago, our board again provided $4,250 for this program, for this population, and they were really planning to implement it later into the fiscal year in the last quarter. But due to COVID-19, they are unable to implement it the way they want it. So I received an email. They were asking to see if we can amend the contract, make an exception, and extend the contract for another 90 days. So instead of our contract end June 30th to end September 30th, they pretty much told us if you're not going to extend our contract, we will not be able to utilize the funds. So they're going to leave the money on the table. They did not apply for fiscal year 2021 levy funds. They didn't submit a new application. All they are asking, whatever you already approved to our agency for this program, can you please extend it for another 90 days? I, as an executive director, I don't see a problem with that. I think we can go ahead and allow to extend the contract for 90 or maybe even 120 days. But I wanted to see what recommendations you guys might have.
That only makes sense to extend it, and they haven't been able to do anything.
Agree. I mean, you might as well.
Right, we have to be flexible.
Well, it appears that everybody's in agreement. So we will have to do a motion of this. I will re-talk to them. It will be between 90 and 120 days. I'll have to re-talk to them to see exactly what the plan is. But again, this doesn't mean new money from us going to them. It just means that we extend the date of the contract. Okay.
Is that what's called the Fostoria Use Build? That's what it's called?
That is the project. They call the project Fostoria Youth Build. It's a project that is, GLCAP is the one leading the project in partnership with Fostoria Learning Center, Ohio Means Jobs, Seneca County DGFS, Seneca County Pivot Corps, Vanguard Sentinel, and Terra State Community College.
So it's not specific to Fostoria or anything like that, or is it? Is it only for Seneca County folks, or?
It is, give me 1 second. Refers are coming for Seneca County residents. Actually, it's a little bit more specific to Fostoria. When they apply for this federal grant, because of the poverty guidelines, Fostoria was the area they qualified. So was a main focus on the Fostoria 18 to 24-year-olds.
So it is specific to Fostoria residents.
Correct. Seneca County portion is what we are paying only. It's coming out of Seneca County levy funds.
Gotcha. Thank you.
Okay. We recently applied for an emergency COVID-19 grant to Ohio Department of Mental Health and Addiction Services. They sent the main application to the federal government, and we were made aware so far only verbally that we were awarded $84,377.19. We applied together with Erie, Iowa, and Huron County, so as a 6-county region. We took the lead to send the application completed, and we are the fiscal agent. And into our grant, we wanted to enhance crisis hotline services and implement the SBIR model and make sure all violence hotline staff are being trained in their model. We have 5 main goals for this grant. So again, when we send the grant application as the 6-county region, we listed Fallens as the implementing agency for this grant. This is a very short period of time. This is just again related to COVID-19 to make sure individuals are linked to treatment, and we enhance our crisis hotline. And obviously want to make sure, the feds wanted to make sure that we have a response for individuals struggling with mental health due to COVID-19. So while I don't have anything in writing yet to say, here is your notice of award, I am recommending to approve this in a motion, just in case I get the letter the day after the board meeting, and then I'll have to wait another 30 days before it's being approved, just because they wanted us to implement it as soon as possible. If for whatever reason, we end up that we never receive this grant, the contract will not be signed. So I want to make sure you guys are aware, just in case we approve it through a motion and for whatever reason we never get these funds, the contract will not be signed with Fallens and the other 2 boards. A portion of this grant is also to promote behavioral health services that are available in the 6 counties and try to link individuals to such services. I will tell you, just on a side note, and I talked to Robin about this for like 2 hours today. On a side note, a big pie in the sky will be for us to try to implement a 24/7 chat line in partnership with the other 2 boards and Firelands. very similar to the hotline or the text line, but to implement a chat line where you can outreach to people. One example that comes in my mind, if you, for example, go to a website like Verizon and you look to buy a plan or a phone, a box pops up on your screen and somebody wants to talk to you to see if you need help. It would be very similar here, where maybe on all behavioral health agencies in our district and our board, we have this capability that a box will just pop up for anybody maybe searching our website, where we can chat with them and link them with treatment services. So we might be able to use some of those funds for the 24/7 chat line. Any questions?
Did you say, is there a time, an end date to that grant, like when you have to use it by? Use it or lose it, right?
You lose it? Yes, correct. Give me 1 second. To be honest, we applied for 3 grants in 3 weeks. So I'm trying to understand which one is which. This one, it's actually, I believe, for federal fiscal year 2020, got to end September 30th
Okay.
of this year. We applied for another grant, which will be the next thing on our agenda. Trying to get information about that grant. But before I move there, any other questions? All right, the other grant, I really we don't really need a motion yet because I think it's further along, but I just wanted to give you an update. There was another emergency COVID-19 federal grant that we applied for. It's a little bit less money, this one, but we did apply, I have it in front of me. We did apply to assist some local organizations with outreach to our behavioral health population. Individuals who are severe and persistent mental ill clients through NAMI and violence. We did outreach to also help individuals who are coming out of prison with some additional support, individuals who are homeless to Community Fortress and Morrison House. So when we send this application, we have listed 5 or 6 agencies on our application for close to $30,000. Again, to provide outreach to these individuals who are already into our system or who maybe are homeless. I don't have a lot of information on that, but there will be only a 90-day grant if we get it, with a possibility to expand for another year. So we received a few COVID-19 grants that are all federal grants that we quickly went ahead and submitted applications. If any of them will to be received, we'll come back to you guys for a motion. But the one we are very confident is the one I talk under number 5. Any questions? Back to grants. Prior to COVID-19, we had I joined a meeting in Mansfield with the leads of the Metrich Drug Enforcement Unit, and Metrich, I believe, is covering maybe 9, 11, 13, I'm not sure. They're covering around 11 counties in North and Central Ohio. Metrich is the Drug Task Force Unit. And they, at that time, were assisting with some information to apply for a regional grant to implement QRT teams in these counties. Now, I want to remind you that 2 counties in our board district, which is Seneca and Wyandotte, they are Metrich counties. So they get special money from the state to run a drug task force. Sandusky County is not. So just to give you a little history, Metrich is really not accepting new counties to join in. That's why around 4 years ago, Sandusky County wanted to start the drug task force unit, and they didn't have the funds because there just wasn't any funds available. And at that time, they ran for a local levy to pass, to assist them with their drug task force unit, which they did pass. Back to QRT project, I met actually today with Tiffin PD, and they really want to implement the QRT project, and our goal is middle of July. What QRT means is, just to give you a short summary, is our workers, whoever we're going to identify, going to meet with law enforcement approximately twice a week and go over the list of any individual countywide who overdosed. They're going to take their list, try to get all the data they can, and go really to these people's homes and knock on the door. So it will be a law enforcement with a behavioral health professional. And the reason to knock on the door is to engage them into treatment. It's not to arrest them, not to put them in jail, it's to link them with treatment. Behavioral health professionals feel a little bit more comfortable going with the law enforcement. This is really the model that has been implemented in a state. Through this grant, Drug Task Force will receive funds to purchase a vehicle just for this project, to go to these homes, as well as transport the individual to a treatment facility if needed. So Tiffin PD, the Drug Task Force, I'm pretty sure for Astoria PD, everybody seems to be on board in Seneca County, and they would like to implement this by middle of July. I also had discussions with Wyandotte County, and they are also planning to implement this sometimes this year. But again, I just wanted to give you a heads up. This is not, I really don't need no motions here yet. I just wanted to let you know. We tried something similar in Sandusky County. It didn't really happen this way, but we had a partnership with the Sandusky County Prosecutor's Office 2 years ago. Their project worked for a little bit, but it's no longer in existence.
Are the Tiffin PD or any other agencies intend on stopping charging every OD then? Because I know it was always their policy, if they had an OD, they charged them with possession. I didn't necessarily agree with it, but I know that's what they did.
To be honest, I don't know that answer, Pat. I don't know the answer. I know what I know a little bit going back to Sandusky County. I know when we wanted to implement something similar in Sandusky County, and at that time, Prosecutor Brown said, "Well, it really makes no sense because these people are going to say no, and due to the Good Samaritan law, they have immunity. 3 strikes. You have 3 tries before you can actually go ahead with charges." So they were in Sandusky County. I'm not sure if they were calling it a charge, but they were giving everybody kind of like a letter from the prosecutor's office, say, "Hey, this is your first strike. This is what you have to do. This is your second strike. Third strike, you lose your immunity." But I'm not sure what Tiffin PD is currently doing.
And that makes total sense. But just to me, it would, if somebody is criminally charged for overdosing, and then a law enforcement officer shows up at their door wanting to get them into treatment, that seems to be a barrier to me. I mean, there's going to be an instant distrust.
Correct. I understand. And I do know, Pat, going to some statewide meetings, I heard that some law enforcement agency charged them with, I can't think of the charge. I just can't. The words just don't come in my mind right now. But it's not like an overdose charge. It's not like a drug possession. It's kind of like causing panic, maybe something like that. Okay, so they try to find different charges just to, according to some law enforcement agents, are saying, "Hey, I'm trying to charge him to get him in front of the judge to save his life, because if I don't charge him and walk away, he might overdose again in a few days." So I'm saying, like, correct. There are different. Yes, yeah, there's different statements running around, correct. But I can find that out. That's a really good point, Pat.
I just think it presents a barrier. I mean, I'm not arguing whether it's appropriate or not. I think there's different views on that, but it definitely presents a barrier.
I agree, especially from the clinical perspective. Why take a clinician along and yet you're going to charge them? With a law enforcement thing. So that would almost negate the clinical person. So I definitely agree.
I will check on that and let you guys know. I don't want to talk for Tiffin PD. And another thing I will tell you that I think it's important. People going, we'll call them more like linkage individuals. These individuals will not receive treatment at their home or on site. This person is tasked to link them with treatment now. So we have to have some linkage caseworkers that will know where detox is, we'll know where residential treatment is, we'll know where outpatient is, we'll know where recovery housing is. So we just need like some behavioral health experts when it comes to resources to go out with law enforcement. But most likely we're not going to have therapists going out, and no assessment going to be conducted out in the field. Any other questions about it? I will, again, just on a side note to this, it does appear, and the reason I'm saying appear because I don't know if we have the fact yet to be able to prove it yet, but we might. We are looking at the data. But it appears we have a spike in overdoses in general in the 3 counties. And actually suicide attempts as well. But I think there are a few factors, but we do see a spike in overdoses in all 3 counties. Okay, I will also give you an update about PPEs. I think due to COVID-19, I should give you guys an update, but we continue to get PPEs from various state agencies. I usually pick them up from the Hancock County office. That's kind of our Northwest Ohio location to pick them up. But we provided I would say all of our treatment agencies and residential facilities with various PPEs, including masks, hand sanitizer, gloves, hand soap, and we'll continue to do so. We'll continue to do so as I'm going to actually even get more. I just wanted to let everybody know, and we actually provided some to the homeless shelter and emergency homeless shelter. These are agencies we don't really have a contract with, but we felt it is very important for them to have the necessary PPEs. If you have any questions, again, let me know. But we've been fortunate to got lucky to order some really early, and we didn't have a problem having them on hand when needed.
Do any of the individuals at any of the homes, they don't ride together or anything like that, right? They all have their own transportation, or not necessarily?
Robin, do you want to answer about recovery house ladies?
Can you repeat that?
Well, I guess what I'm asking that is because, like, if they're being transported, well, they live together, so those rules wouldn't really apply to them. So even if they do have to ride together, that's not an issue of having to wear PPE or anything like that when they're driving.
Correct.
Never mind. Keep going.
I mean, we certainly encourage it anytime they're going out to the stores or anything like that. We certainly don't want them bringing it back to the home and having that situation. So we encourage it just like it's recommended by the CDC or the governor.
But yes, Ruth, I would say that not all the people in the recovery homes have transportation. Usually they carpool, but you're right, they already live together, so it's not really making a big difference being in the car together. Robin, go to number 9 on the agenda.
Okay. Every year at this time, I work with the admin committee chairperson to begin MIRCHA's annual evaluation. Dean Bliss is our current chairperson, and so him and I exchanged emails and talked earlier this month regarding MIRCHA's fiscal year 20 annual evaluation. And given the current state of affairs, Dean and I discussed ways to handle the evaluation differently this year. Each of you should have received an email from me on May 5th with the instructions on what is needed from each board members and the necessary documents to complete the evaluation. The email also included his fiscal year 19 evaluation, so you could reference his past performance and his current goals. I just want to remind everyone that the evaluations are due back to me by June 9th. so I can compile all the information. Please don't hesitate to ask me to mail the packet to you if you need that, or to assist in getting the information back to me. I think the idea was that if people could, they would email it back and I would compile it. But if you need a packet to mail it back or you need anything printed, just let me know. Dean is aiming to present the evaluation during our executive session during the June 2020 board meeting. If that meeting is not face-to-face, then the discussion will be tabled until the next face-to-face board meeting when we can have an executive session. If this can't be done in June, then Mircha will just continue to work on his fiscal year 19 goals until the fiscal year 20 goals can be provided to him. And due to the resolution that we passed back in April, this evaluation is really only for performance evaluation reasons. And there is to be no change in any board employee's salary at this time. So it's not like we have to have it done for any salary change. So just a reminder to send me the review material by June 9th if you have not done so already. I do have some of them at my office. I think I've gotten 3 so far.
I think Robin should get a raise.
Oh, thanks, Pat. I too qualify under the April resolution though, so that'll have to wait. But thanks.
Any questions to Robin?
Mircha, can I go back and report on the CTP question you asked if there's nothing about the evaluation?
Yes, go ahead.
You had asked for the numbers to date, and I was able to pull it up real quick. We've had 22 cases to date. 11 of them have showed. 8 have not shown for their initial appointment, and then 3 are scheduled to be released from prison but have an appointment for when they get out. So about 50% have shown, and then the rest are not showing. So those are people that they can't even spend any of the money on. They haven't showed.
Is that applicable to any certain county, like more counties are attending or coming, showing up?
Well, we only get the Seneca, Sandusky, and Wyandotte County cases. If they're from another county, then they're going to be given to whatever agency is working on CTP there. So I don't even get them from another county. I did get one case where they got confused on Sandusky. They thought it was Sandusky County and it was Sandusky the city. So then that person wanted to go up to Sandusky the city.
County, not Wyandotte.
But I mean, are more of those people like Sandusky County versus Wyandotte or Seneca, or do you not track that?
I haven't, but I